Did you know that by the age of 80, around half of people either have cataracts or have had them removed? But here's the important part. Most people actually start noticing cataract symptoms much earlier in their life. In fact, many people begin experiencing issues like glare, blurry vision, or trouble with night driving by their 60s. And the average age for surgery is right around mid-60s right now. So, the real question isn't, how old are you? But the question really is, how much is your vision affecting your lifestyle? In this video, I'm going to walk you through the signs that actually matter and discuss the risks of waiting and how to decide what timing makes sense for you. And as we start, it's important to look at a common belief about cataracts and why it isn't quite true. So a lot of people think cataract surgery is something that only becomes relevant in their 70s or 80s. You've even probably heard someone brush it off by saying, "I'll worry about that when I'm older," as though cataracts only belong at the far end of life. While that belief is widespread, it doesn't square with what actually happens. The stereotype has roots in history. Many years ago, surgical tools and techniques really weren't as advanced as they are today. So eye doctors often waited until cataracts became more severe before operating, and that's because the complication rate was much higher. That older standard that shaped how generations thought about cataracts kind of stuck over time. But modern medicine has changed this reality. Cataract surgery today is far safer, far more efficient, and it no longer demands that you wait until your vision is almost gone. And the real surprising part of all of this, the average age for cataract surgery is now around mid-60s, not late 70s as before. And this number does vary depending on where you live and your health. What this means is that a lot of people who still feel active and young at heart are having their vision restored sooner than maybe ever expected. So picture someone healthy at 65, still working, still driving, still traveling. When glare from headlights makes night driving stressful, or when reading small print becomes a real strain, those frustrations aren't just old age. They're potentially cataracts interfering with your daily life. The hesitation for surgery comes from seeing eye surgery is something bigger than it is. But the truth is reassuring. Today, cataract surgery is usually an outpatient procedure that takes about 15 to 20 minutes, uses tiny incisions, and lets most people go home the same day, often noticing clearer vision within hours to a few days after surgery. Just knowing that fact changes how people see it. It shifts from being a last resort to a safe, straightforward option when vision gets in the way. But it is still surgery. Because techniques and lenses have improved so much, many surgeons no longer advise waiting until a cataract is extremely dense. Instead, the decision now really centers on how much your vision limits your lifestyle. It's not your age that decides. It's whether your eyesight allows you to drive safely, read comfortably, or enjoy your hobbies and activities without constant compromise. So while many still picture cataract surgery as a far-off concern for their golden years, the reality is very different. More and more people are addressing it earlier, not because they're old, but because their eyes are ready, their vision is ready, and modern surgery makes the choice more practical. And this really leads to a very important consideration. If waiting isn't necessary anymore, what happens when you wait too long anyway? The hidden risk of waiting. So it's easy to think of holding off on surgery to keep things simpler. But cataracts don't stay still. They progress over time. As the clouding in the lens increases, the surgery itself can become trickier. Recovery can take longer, and the results are sometimes less predictable. One of the most important changes happens when a cataract reaches what's called a mature or dense stage. Over time, the natural lens becomes not just cloudy, but harder as well. In the early stages, the cataract is softer and easier for the surgeon to break apart and remove from the eye. But in the later stages, The density of the lens means far more energy has to be used inside the eye to remove the cataract. Surgeons often need to use higher levels of this ultrasound energy to fragment the hardened lens, which can increase inflammation and slow the early healing phase. That's why acting at the right time usually gives you an easier operation and a faster recovery. But this is something you need to discuss with your surgeon. And you need to think about it from your own experience. A vision that once only felt mildly bothersome might gradually shift into something that makes everyday tasks unsafe. Driving at night, for example, often becomes one of the first real warning signs. Glare, halos, and reduced contrast sensitivity turn routine trips into stressful challenges. By the time the struggle feels urgent enough to take action, the cataract is often much denser, and that can influence how smoothly surgery and your recovery can unfold. I've seen many patients who waited years before finally agreeing to surgery. And though most of their outcomes were still very good, sometimes the road to clear vision took longer than it would have if they had acted sooner. Instead of regaining sharp clarity in just days, the stabilization process stretched into weeks, simply because the dense lens required more energy and added more stress to the eye during the surgery. And research has consistently shown the same pattern. Advanced cataracts make the procedure more technically demanding. Surgeons can still achieve excellent results, I need to stress this, but denser lenses mean more moving parts and more time spent in the operating room. And so while modern cataract surgery remains one of the safest operations performed worldwide today in 2025, waiting increases the likelihood of extended recovery and less immediate clarity. And here's the balance to remember. Complications are still relatively uncommon, and surgery is generally safe no matter when it's done. But by choosing to wait until the cataract is severe, you do increase the technical difficulty for the surgeon and sometimes the effort your eyes need to heal. So, in other words, you may trade the peace of mind of waiting until later for a tougher experience than necessary. How cataracts affect your daily life and what matters most to you. And this is where timing and personalization become the real deciding factors. Cataract surgery isn't about hitting a certain birthday. It's about recognizing the moments when your vision no longer supports the life you want. For some people, cataracts cause almost no disruption for many years. And then for others, even an early cataract can interfere with daily independence and confidence. Here's an easy decision framework to think about. First, ask yourself, do you notice any of these changes? Trouble driving at night or with oncoming headlights? Increasing glare or halos? Need more light to read? Frequent changes in your glasses prescription? Double vision? Or difficulty with everyday tasks like cooking, reading, or using a computer? If you answered yes to any of these, those are signs that it might be time to have a conversation with your ophthalmologist about your cataracts are the cause of these symptoms. Guidelines and expert surgeons emphasize functional impairment, not just the eye chart, when deciding surgery. So this means even if you read the chart well, if your vision is impacting your daily safety or comfort, surgery may still be the right option. Second, consider risk factors that can shift the timeline earlier. Conditions like diabetes, prior eye injuries, long-term steroid use, or significant UV exposure can all make cataracts appear sooner. If any of these conditions apply to you, it's a good reason to schedule an eye exam earlier rather than waiting. Third, think about your goals for vision after surgery. Modern intraocular lenses aren't one size fits all. Avid readers, golfers, gardeners, or frequent travelers may all make different lens choices based on their lifestyle needs. Multifocal, extended depth of focus, toric, or even light adjustable lenses can restore different ranges of vision and decrease reliance on glasses. But it's important to note, many of these premium lenses may not be covered by insurance, so discussing the cost, expectations, and goals with your surgeon is essential. And I'll say technology has also made outcomes more precise. Tools like intraoperative aberrometry let surgeons fine-tune the lens power during surgery for better accuracy. What this ultimately means is that the results can be tailored even more closely to your individual needs, which adds an extra layer of personalization to the decision-making process. And let me give you some real-world examples to make this a little clearer. A hypothetical 50-year-old with diabetes might need surgery much earlier to stay safe on the road and keep working without visual struggle. On the other hand, a 75-year-old with slow, mild cataracts may comfortably continue the routine without surgery for many more years. These two very different scenarios highlight why age is less important than your unique circumstances and your risk factors, as well as your goals. So instead of asking, am I old enough for cataract surgery, the better question becomes, does my vision still let me live the way I want to live? That's the shift from age to function, from numbers to personal experience, and it sets the stage for the bigger picture. How to know the right time without relying on a single number. So in conclusion, the main takeaway is very simple. The right time isn't tied to your age. It's when cataracts start limiting the way you live. Whether that means struggling with glare at night, needing more light to read, or feeling less confident day to day. Most patients are satisfied with outcomes. Guideline summaries report satisfaction rates as high as about 95%, and surgery can restore safety and independence. There is no upper age limit. Cataract surgery is commonly and successfully performed in people in their 70s, 80s, and beyond. If glare, night driving, or reading are getting harder, call your ophthalmologist for a cataract evaluation, or book a consultation to discuss your goals and your lens options. Thank you for watching the video. If you want more clear, trustworthy eye health guidance, subscribe and hit the bell for updates. And if you have any general questions, drop them in the comments below. I'll do my best to reply and help guide you as a trusted resource. Thanks again, and see you in the next video.